All right, we're following some breaking news out of Annapolis. Right now, Maryland Governor Larry Hogan is giving an update on COVID-19. The state's response to this dramatic rise today marked the 7th consecutive day Maryland has reported more than 1,000 new cases a day. More than 760 people are in hospitals across the state. Let's listen in.
Last Thursday, we announced that we would be standing up a new testing site at the Allegheny County Fairgrounds. And I'm pleased to report that this new site will be fully operational tomorrow. More people are dying from this virus, including now 4,084 Marylanders and nearly 245,000 Americans. We have been and are still doing much better than 40 other states in our health metrics. But as I have repeatedly said, this deadly virus does not recognize state borders. Our updated contact tracing continues to indicate that family gatherings are the most common and therefore the highest risk activity among those who were recently infected with COVID-19. Among those who were recently infected with COVID-19, there's an increased number who recently tested positive, the report working outside of their home, a marked increase in the number of people infected with the virus who say they've recently dined indoors at a restaurant, as well as a large increase of those who have recently traveled out of state. We cannot afford to ignore these trends and patterns. Last week I said that warning lights were starting to blink on the dashboard and that it appeared we were approaching a critical turning point in the fight. Today, I'm reporting that we have now crossed over into the danger zone. Too many residents and businesses have COVID fatigue, and they've begun letting their guard down. Too many Marylanders are traveling out of state to unsafe locations, hosting large gatherings, crowding in bars, attending house parties, and refusing to wear masks. Too many businesses are failing to comply with the state regulations and orders, and counties with the primary responsibility for ensuring compliance of the law and enforcing public health regulations are, in some cases, failing to do so. Sadly, as a result, the virus has returned to our state in a big way. We absolutely must, and we will, continue to use every tool at our disposal. From day one of the pandemic, I have never hesitated to take the actions that I believed were necessary to keep the people of Maryland safe, and I will continue to do so. We do not want to take actions that will further burden our struggling small businesses or actions to shut down our economy. Our primary goals continue to be keeping our hospitals from overflowing and stopping more Marylanders from dying. Today, I am announcing that effective tomorrow, November 11th at 5:00 p.m., so roughly 24 hours from now, the capacity for indoor operations at bars and restaurants will be reduced from 75% back to 50%. Bars and restaurants in Maryland have only been permitted to open for seated, distanced service only with strict capacity restrictions. No standing in bars has been allowed. Patrons have been required to spread the tables at least 6 feet apart, and no large groups larger than 6 per table. Now, many of those are not being followed. Customers who are not seated cannot be served, and tables must be cleaned and disinfected between each seating, in accordance with guidelines from the CDC and the Maryland Department of Health. This order will be enforced. In addition, today the Maryland Department of Health is issuing a new public health advisory, strongly warning against any indoor gatherings of 25 people or more. This is consistent with all of our contact tracing data and an uptick in cases resulting from family gatherings and house parties. It's easy to feel comfortable thinking that just because you haven't engaged in any of the activities that we typically think of as high risk, that it's enough to keep us safe. The reality is that you can just as easily get the virus by hosting a group of friends to watch football on Sunday, or celebrating a family birthday, or the Thanksgiving holiday that's fast approaching. Each of us has to be more cautious and more vigilant. The Maryland Department of Health today is also issuing an expanded advisory regarding all out-of-state travel, which, according to our contact tracing data, is responsible for a substantial increased number of cases. Under this expanded travel advisory, all Marylanders are strongly advised against all non-essential out-of-state travel to any of the 8 states with a positivity rate above 10%, or any of the 35 states with average case rates above 20 per 100,000. This applies to all personal, family, or business travel of any kind. You should immediately postpone or cancel travel to any of these states with spiking metrics. Anyone who has to travel outside the state for an essential reason, upon their return to Maryland, should immediately get tested for COVID-19 and self-quarantine while awaiting the results of the test. Effective immediately, all state employees who are approved to telework must again begin a period of mandatory telework, except for essential, direct, public-facing services and other essential personnel. Earlier today, I convened an emergency teleconference of my entire cabinet and directed them to immediately execute this period of mandatory telework among the employees in their agencies. And we are strongly advising all employers across the state to limit their workforce only to workers who are essential and who are not able to telework. Businesses are strongly encouraged to develop plans which limit the proximity of employees by rotating employee hours, instituting split schedules, shifts, shorter work weeks, or staggering start, break, or shift times. The Maryland Department of Health is issuing an emergency order today to activate the next level of our hospital surge capacity by adding alternative care site capacity and to provide additional staffing support and clinical care to nursing homes in the event of further outbreaks. These emergency plans will be activated immediately when our hospitalizations reach a critical threshold. Finally, the Maryland Department of Health is issuing updated guidance to stop the spread of COVID-19 at nursing homes and assisted living facilities. To protect our loved ones, Marylanders should take all precautions, including all visitors being tested prior to visiting a nursing home facility. Nursing home and assisted living program staff must minimize their contact and avoid all gatherings, and work with their management on communicating early and often about all infection control issues at their facilities. We're also requiring all nursing homes to develop a sufficient PPE stockpile for the winter surge. The actions that we're taking today are necessary based on all of the numbers, the data, metrics, and projections, and are being taken in consultation with the top doctors and public health experts from our Maryland Coronavirus Recovery Task Force. These actions...
You've been listening to Maryland Governor Larry Hogan remind all of us that this virus, COVID-19, does not adhere to borders. He says this virus has returned to our state in a big way. Now, there's a lot for you to know, but let me just tell you a few things. One, he's saying that family gatherings and home parties are the most common way that COVID-19 is spreading. That there's also been an increase in people who said they have dined at restaurants indoors and traveled out of state. So the governor is talking about expanding a travel advisory, urging people not to go to other states where the rates are rising past a certain limit. telling people if you have to do that, when you come back to Maryland, you need to be tested for COVID-19 and you need to quarantine until you get those results, and urging workplaces to limit their workforces to ensure that the people there are the ones who are essential and that everybody else should be teleworking. We're going to continue to unpack this for you because there is a lot to go through. But ultimately, the governor is reminding us that part of stopping the spread of COVID-19 is on us, that we have a responsibility to help keep this from spreading any further. We'll have an update for you with more of this coming up at 6 o'clock. Now, some Maryland counties have already been calling on Governor Hogan to pull back from stage 3 of the state's roadmap to recovery. And today, Montgomery County lawmakers took action on their own. So starting at 5 o'clock today, gatherings of more than 25 people are no longer allowed. Certain businesses are limited to 25% capacity, which include indoor restaurants and retail stores, fitness centers, museums, art galleries, religious facilities. Hair salons, barbershops, massage and nail salons are already reduced to 25% capacity or 25 people, whichever is lower. This is very, very important stuff.
Yeah, unless